How you doing? Dr. Ulysses Jackson, back with the last part of the three-part series on post-traumatic stress disorders. What I want everybody to know is that when we talk about these mental health disorders, this is not to be a downer or anything like that, but this anxiety, this depression, this post-traumatic stress, autism, these are situations and issues that we must address and face. And with all of the violence, the killings, and COVID, and it's real big on everyone yelling out, go see a mental health doctor, go see someone. And there's so many misdiagnoses and us as people trying to diagnose our family and friends. And what startles me sometimes is that I can go past a mechanic shop and see a young man or, changing the brakes on a car. I do not run home and say, guess what? I know how to bleed brakes and change the brakes. I don't do that. It's unfair to me and the danger of someone else that could be in my car and the brakes don't work. Same thing with a dentist's office. One of my loved ones could be in a dentist's office, getting their teeth cleaned or fixed. I don't come home and say, I'm a dentist. But it's so common for us to look at someone and say, you look like you got post-traumatic stress. Oh, that must be anxiety. You're anxious. And I think it's just so unfair to us and the other person. But if by chance you do that, go to a reliable source, such as the Diagnostic Statistical Manual, where this is where they're going to give you the criteria and the features of every disorder: autism, anxiety, depression. They're going to give us that information. So at least you have a gauge to say this looks like that, And today we're going to finish up this post-traumatic stress, and we're going to talk about once it's identified that you may have these features and that you may have post-traumatic stress, what do we have? What kind of help and assistance do we have? The interventions, prevention, and the therapy. First, there's two ways you could go about it once diagnosed with post-traumatic stress. You can go with individual therapy, medication, or group therapy. The purpose of the group therapy is that you'll be with some cohorts or some individuals that experience the same thing that you do, like when anxiety with agoraphobia, attachment disorders, reattachment disorders, social anxiety. You're going to be with a group of people that identify with you. If you're not really that type of people person, you more or less back up and isolate, or you want to individualize. So I'm not big on medication, but sometimes when an MD recommends it, I don't fight that because I'm a PhD in clinical research. I'm not an MD. So when a medical doctor, prescribes you a medication, go on his clinical advice, because that's what he's a doctor, specializes in that. And I specialize in the research. I'm the guy that once he gives you the opiates, I say, how do you feel now that you're taking the opiates? Have you had any adverse reaction to that? And then the substance abuse set in. I'm that guy. See, the prescribing doctor give it to you. 9 times out of 10, he's not going to sit there with you and go through this. So again, we've been diagnosed with post-traumatic stress. Are we going to take a medication regimen, or are we going to go with cognitive therapy, EDMR, or DBT therapy to address these recurring, intrusive thoughts? This is the thing that we're going to have to figure out. You have also prolonged exposure therapy, which is where we're going to kind of introduce you to those triggers and work on with those triggers for post-traumatic stress. So using EDMR or cognitive behavioral therapy, CBT, these are ways to address this post-traumatic stress disorder. Again, as I keep telling you, and I can't reiterate it enough, using this book right here, this is just a guide to what the diagnoses are and what they aren't. So what this really does, it gives you criteria that, like said, if you have A, B, and C, it could be this. So as our friends, see us and go, oh, you look like you're anxious, or you might have post-traumatic stress. Go to the book. But by no means, I want to be clear, by no means is this discussion allow you to say, well, I know how to diagnose it. It's just giving you a roadmap of what to look for. Give you examples. It's like me going down a block and I see my neighborhood mechanic changing brakes. And I sit and I talk to him while he's changing the brakes. When I come home, does that mean I know how to change brakes? No, I watched him, and he did. He changed brakes. If I go to my dentist office with one of my children, and I watch the dentist clean teeth, can I come home and then say, hey, I'm a dentist? This is one of the issues we're having. People are Googling mental health disorders. They're going to their friends and they're becoming counselors. This is terribly, terribly wrong. I stay in my lane. When I had a issue sometime with my boiler back in the days, I didn't go bleed the boiler. I went to a professional and had him come do it. This is very, very serious stuff. And I want to get into the differentials in the next couple of segments or sessions, because a differential is you giving someone a diagnosis of something that mimics it, like an anxiety disorder, whether it's agoraphobia, whether it's social anxiety, or whether it's generalized anxiety. We could say, hey, it's that. But there are different features for each one of those, So again, we discussed, please do not take your time to take anything that I'm saying or anything you hear on the internet and self-diagnose yourself, your friend, your children, or loved ones. And remember that there are options when it comes down to cognitive behavioral therapy or medication. Whatever you're more comfortable with, go that route. If you want group therapy, because you and a group of people suffer from the same post-traumatic stress disorder, then I suggest you tell your therapist or your doctor you're interested in sharing a group of men and women that experience the same experiences that you've had, the same type of trauma. Again, the Diagnostic Statistical Manual, it's a guideline, it's a step to show you how to identify disorders and negative behaviors or maladaptive behaviors. And again, therapy, we have to look at it where no one likes to jump up for joy. Hey, I'm going to therapy. I want to see no, these are issues that, you're experiencing that you want to go and discuss. When I have to call, again, I use these plumbers and dentists because these are professionals that I deal with on a regular basis. And I don't want to, with joy, call my plumber. For what? That means I have a problem. Who with joy runs and says, I want to see my mental health doctor? Nobody does that. That's why, in my view, it was dormant for so long. And people were living with trauma. People were living with pain. And they didn't know how to get it. Now, it became like a fad. But a lot of us aren't skilled in that. Again, I told you, I have personalities that got thousands and millions of listeners that are just giving diagnosis. Go to a professional, get it done, and post-traumatic stress, you can live with it. It's something that we can get through. This is Dr. Jackson. I appreciate your time for spending this couple of minutes with me to go over the interventions of post-traumatic stress disorder. Thank you.